Dr. William Berger here. February is American Heart Month, so I just wanted to take a moment to talk about an aspect of heart health that is not always addressed here in the United States. So beyond the regular cholesterol panel, which is going to give you total cholesterol, HDL cholesterol, LDL cholesterol, LDL being the so-called bad cholesterol, the one that contributes to atherosclerosis. There are two tests that I would recommend that people speak to their physician about ordering. One is Apolipoprotein B, because that's going to include other atherogenic LDL type particles beyond the LDL that might be missed just in the regular cholesterol panel, so that even if a patient is on a statin, for example, and the LDL cholesterol is controlled, there might be additional ApoB containing particles contributing to risk for heart disease and stroke that aren't being accounted for, and there would be the potential for either improved lifestyle or lifestyle plus perhaps an additional medication to help control cholesterol. The other one is called lipoprotein a, or LP for short. This is an additional risk factor in terms of heart attack and stroke. People who have an elevated lipoprotein a have 2 to 3-fold increased risk for heart attack and stroke, depending on how high it is. This test is standard of care in Europe and Canada and starting to become utilized in the United States, but most often by cardiology, here and there by internists like myself. So if you're going to your primary care physician or your cardiologist, it would be a worthwhile discussion to have about ordering apolipoprotein B or lipoprotein a to get a broader assessment of your cardiac risk. Of course, if you would like to learn more about what we can do in our practice to help you optimize your health, we are Northeast Medical Practice located in Great Neck, New York on Long Island, 516-604-3418, or online at northeastmedicalpractice.com. I've also recorded a podcast with the cardiologist, Dr. Dubowsky, which is on the LongevityMD podcast that I host on Spotify, if you'd like to learn more about lipoprotein A. And also, of course, you can check out our other social media, our YouTube channel, and so forth. Remember that everything that I speak about on these videos is for educational purposes only. No doctor-patient relationship has been formed. And if you have particular questions or concerns, please don't hesitate to reach out to your medical professionals. But until we see each other next time, be in good health.